students, today we are going to demonstrate stomach. So as you can see, this is stomach in situ. Okay. So if you are seeing the stomach in situ, you can see you have already studied the abdominal quadrants and abdominal regions. So if you see the location of stomach inside the abdomen, you will notice that the stomach lies mainly in the epigastric region, the left hypochondric region, and the umbilical region. Okay, so this is the stomach in situ. So this stomach has two ends. See, this is stomach. This stomach has two ends, two surfaces, and two borders, which are known as curvatures. Okay, if you see the stomach in anatomical position, see, this is the anatomical position of stomach. How do you identify that which end will lie above and which end will lie below? So by palpating the ends. See, this is the cardiac end or the upper end of the stomach. This is the lower end or pyloric end of the stomach. See, the lower end has an anatomical sphincter by the thickening of the circular muscle layer of the stomach at the pyloric end. So when we feel the lower end, we feel thickened muscular coat. So that is how we decide that this is the lower end of the stomach and this is the upper end. At upper end, we don't find any thickening of the muscle. So this is known as the cardiac end of the stomach and this is known as the pyloric end of the stomach. So now when you know the ends, you will hold this end above and you will hold this end below. Then you will keep the stomach in the epigastric, left hypochondriac and umbilical region. Okay, like this. So this is the cardiac end, this is the pyloric end, then this is the lesser curvature which is extending between the cardiac end and the pyloric end, and starting from the pyloric end, this is the greater curvature of the stomach. Okay, then this is the anterior surface and behind this is the posterior surface of the stomach. So we have two ends, two borders or curvatures and two surfaces. In the body, if you see in the body, see, this is the cardiac end of the stomach where it is continuing with the esophagus above, and this is the pyloric end of the stomach. I can feel the thickness of the circular muscle layer. So this is the pyloric end of the stomach and this is the duodenum. Okay, this is the lesser curvature where you can find the lesser omentum attached between the liver and the stomach, and this is the greater curvature where you can find the greater omentum. Okay, so these are the two ends, two borders and two surfaces. This is the anterior surface and behind is the posterior surface. And you should know the anatomical position of the stomach. So I already told you how you have to hold the stomach in the epigastric, left hypochondriac and the umbilical region. This lesser curvature you have to keep almost straight. Okay, so ये जो lesser curvature होता है, ये इसको हमें थोड़ा straight रखना होता है, like this. So it is oriented obliquely. Now this stomach is divided into parts. It has a fundus, a body, an antrum and a pylorus. How we divide this into different parts? So as you can see that this is the cardiac end of the stomach. You can see the cut end of esophagus. So the point where we have the cardiac notch. See, this is the cardiac end and this is the cardiac notch, because here it is making an angle. The esophagus is making an angle with the stomach. So we draw a horizontal at this level. The part above this horizontal is the fundus. Okay, so this is the fundus. So for fundus, you will draw a horizontal from the cardiac end of the stomach. The part which will lie above this imaginary line will be the fundus of the stomach. Then this part will be the body of the stomach, and then along the lesser curvature you will find an angular notch. We will see in another specimen. See, in this specimen, this is the cardiac end, this is the pyloric end, this is the lesser curvature. It is almost straight. So at this level, we have an angular notch in the stomach, which is known as incisura angularis or angular notch. So at the level of angular notch, we draw a vertical onto the greater curvature of the stomach. So by this vertical, we divide this major part of the stomach into a part above this vertical into body, and part below this vertical is the antrum, known as pyloric antrum. This pyloric antrum, a bit dilated part, and then again this part is known as the pylorus. In the pylorus, we notice this thickening known as the pyloric sphincter, and inside part is known as pyloric canal. So there are four parts: the fundus, the body, the antrum, and the pyloric canal. Pyloric sphincter forms the most distal part of the stomach. And then you can see the continuity. This is the duodenum part. So these are the external features of stomach. Then I already told you about the fold of peritoneum, which is connecting the liver to the stomach and the stomach to rest of the organs. So the part of peritoneum which is attached to the lesser curvature is the lesser omentum. Lesser omentum has two parts: one which is extending between liver and stomach, known as hepatogastric part, and one which is attached to the liver and the first part of duodenum, that is hepatoduodenal ligament. Then the part of dorsal mesogastrium, which is present along the greater curvature. So in the upper part, this stomach is connected to the diaphragm, and then in this part, this stomach is connected to the spleen, and in rest of the part, this stomach has a free fold of peritoneum, which is greater omentum. We can see this in the body also. So this is lesser omentum. This part is duodenum. So this part is hepatoduodenal ligament, and this part is hepatogastric ligament. And then along the greater curvature, the uppermost part of the stomach is connected to the diaphragm, and then you will see that this is a spleen. Can you see the spleen? So this part of the ligament is the gastrosplenic ligament, and then rest of the part, this part, is the greater omentum. In these folds of peritoneum, you will notice blood vessels, nerves, and lymphatics. So if you see clearly, you can notice blood vessels. Okay, so mainly along the lesser curvature, you will notice two arteries. One is left gastric artery and the other is right gastric artery. Left gastric artery is a direct branch from the celiac trunk, which runs from the upper part and then along the lesser curvature. Then there is right gastric artery, which is a branch from hepatic artery, and it runs along the lower part of the lesser curvature, and these two arteries anastomosis along the lesser curvature of stomach. Also, the nerve plexus, which supplies the stomach, which is formed by autonomic nerves and vagus, also run along the lesser curvature. Along the greater curvature, you will notice the gastroepiploic arteries. The left gastroepiploic artery will come from the splenic artery, and it will run from above along the greater curvature, and the right gastroepiploic artery will come from the gastroduodenal artery, and it will run from the lower part along the greater curvature. these two arteries will also anastomose along the greater curvature. So the blood supply of the stomach is mainly derived from left gastric artery, right gastric artery, right gastroepiploic artery, and left gastroepiploic artery. Apart from these, some short gastric arteries also arise from splenic artery and supply close to the fundus area of stomach. So this is the blood supply. Now the relations of stomach. So see this stomach, as you can see, this is the anterior surface of the stomach. So it is, we have removed the rib cage, but the upper part of the stomach. So this is the upper part of the stomach. So it lies underneath the costal cartilages from the 7th rib to the 10th rib. Okay, so the cardiac end lies at the 7th costal cartilage level, and then it is related with the diaphragm. It is also related with lung and pleura. Then it is covered with liver. This is the visceral surface of liver. So when you will study about the liver, there also you will study the visceral relations of liver, and then you will see that this major part of the left lobe of the liver is related with stomach. And you will also notice that this part is related on this part of liver. So this is the pyloric part, which is related to the quadrate lobe of the liver. We will study the quadrate lobe in liver. So, okay, so this is the anterior, these are the anterior relations. And to study the posterior relations, we have to dissect the lesser sac. So here we have given a cut in the lesser omentum. And through this cut, we can see that this major organ, which is lying behind the stomach, is the pancreas. Okay, so pancreas lies behind the stomach. Apart from pancreas, see, we have not given a cut in this part, but I can tell you that the left kidney, the left suprarenal gland, the transverse mesocolon. Okay, see this part, this is transverse mesocolon. It is related posterior to the stomach, but this part is hanging quite below. So transverse mesocolon, pancreas, left kidney, and left suprarenal gland are related posterior to the stomach. Also, in the upper part, in the fundus region, this stomach is related to spleen. So you will find an impression on the spleen, on the visceral surface of spleen, which will be related with the fundus of the stomach. Okay, so it is related to spleen also. So these are the various relations of stomach. Then we come to the internal features. So to see the internal features, we have cut this specimen along the greater curvature. Now you can see the internal aspect. On the internal aspect, first of all, you will notice multiple folds in the mucosa. These are not permanent folds. Permanent folds are seen in the small intestine. What do I mean by that? That these are not permanent folds. Whenever the stomach is full of contents, the stomach dilates. So when the stomach dilates, these folds will disappear. Okay, but there are longitudinal canals from the inside which run along the lesser curvature. Okay, those canals are permanent. Though we cannot see in this specimen, but the canals are present along the lesser curvature. So what happens that the liquids which we take, those liquids enter through the cardiac and they run along the lesser curvature through these canals, and they settle in the lower part of the stomach first. In the fundus, mainly the air which we swallow during food intake collects in the fundus region. So whenever we take X-ray of the abdomen, you will always see that in the fundus of the stomach there is shadow of gas which appears black. Okay, so there is because gas is lighter, it tends to collect in the fundus part of the stomach. So these folds are known as gastric rugae, and you can also see the gastric pits, but for that we have to use a magnifying lens. But we can always see the gastric pits, which are the points of gastric glands onto the mucosal surface. Okay, so you have to remember that this mucosa is folded normally, but as the stomach distends, these folds tend to disappear except along the lesser curvature. So this is about the stomach.